All right, so we've got a good review of our infection control chapter. Make sure that you read this chapter before you get started on any of this, okay? Learning objectives, we're going to explain infection control, describe federal and state regulatory agencies, recognize the principles of infection, identify different types of pathogens, employ the principles of prevention, follow standard precautions to protect yourself and your clients, and demonstrate safe work practices and safety precautions. All right, so explain infection control. What I want you to do is I want you, for your first question that you're going to answer in the answer section of this, I want you to explain infection control in cleaning, sanitizing, disinfecting, and sterilizing. This will be your first question on your review questions, okay? All right, so federal and state regulatory agencies, we've got OSHA, SDS, EPA is disinfectants and EPA registration numbers. State regulatory agencies, we have laws versus rules and noncompliance. All right, recognizing the principles of infection. Being a beauty professional is not just rewarding, it's also a great responsibility. One careless action on the job could cause injury or infection, which is the invasion of body tissues by disease-causing pathogens. If your actions hurt a client or make them ill, you could lose your license or ruin your salon, spa, or barbershop's reputation. Prevention begins and ends with you. So transmission is the process by which pathogens move between individuals and objects. This is the first step to how we get sick. Direct transmission is what we most commonly think of in terms of getting sick, as it involves the transmission of pathogens through touching, kissing, coughing, sneezing, and talking. Indirect transmission occurs through contact with intermediate contaminated objects such as a razor, extractor, nipper, or environmental surface upon which the pathogen resides. Airborne transmission and respiratory droplets. Respiratory droplets and airborne transmission are similar in that transmission occurs when pathogen living in our respiratory tract is expelled through coughing, sneezing, or even talking. You should know how to look for specific things on the label of a product you use for disinfection in a salon, spa, or barbershop. You should always have the following. The list of pathogens against which it is effective should include HIV, HBV, and MRSA. If Pseudomonas aeruginosa is included, the disinfectant will kill other lesser bacteria. The EPA registration number, the words bactericidal, virucidal, and fungicidal, mixing and changing instructions. At a minimum, disinfectants used in salons, spas, and barbershop must be bactericidal, virucidal, and fungicidal. An infectious disease is caused by pathogenic organisms that enter the body. Cleaning and disinfecting procedures are designed to prevent the spread of infection and disease. Make a habit of following the rules of proper cleaning and disinfecting, both in your home and at work. Hand washing, cleaning, and disinfection are all ways in which you can personally combat the spread of disease and safeguard your health and the health of your client. All right, different pathogen types are bacteria, viruses, fungi, parasites, and biofilms. Additional terms that are related to disease contamination is the presence or the reasonably anticipated presence of blood or other potentially infectious materials on an item's surface or visible debris on residues such as dust, hair, and skin. Decontamination is the removal of blood or other potentially infectious materials. Diagnosis is the determination of the nature of disease by its symptoms and diagnostic tests. Germs are a non-scientific synonym for disease-producing organisms. Occupational disease is an illness resulting from conditions associated with employment. Parasitic disease is a disease caused by parasites such as lice and mites. Pathogenic disease is produced by organisms such as bacteria, viruses, fungi, and parasites. And toxins are various poisonous substances that are produced by some microorganisms. All right. Bacteria are single-celled microorganisms that have both plant and animal characteristics. A microorganism is an organism of microscopic or submicroscopic size. Bacteria can exist almost anywhere. Types of bacteria. There are thousands of different types of bacteria, which fall into two primary types, pathogenic and non-pathogenic. Most bacteria are non-pathogenic, means that they're harmless organisms that may perform useful functions to our body. And then there's pathogenic bacteria, which are harmful and cause disease or infection. Bacterial infections. There can be no bacterial infection without the presence of pathogenic bacteria. Therefore, if pathogenic bacteria are eliminated, clients cannot become infected. Inflammation is a condition which the tissue of the body reacts to injury, irritation, or infection. It's characterized by redness, heat, pain, or swelling. Pus is a fluid containing white blood cells, bacteria, and dead cells, and it's the byproduct of an infectious process. A local infection, such as a pimple or abscess, is confined to a particular part of the body and appears as a lesion. A systematic infection is an infection where the pathogen has spread throughout the body rather than staying in one area. These are different types of bacteria. And then we have viruses. Viruses are submicroscopic particles that infects and resides in the cells of a biological organism. Viruses are so small they can only be seen under the most sophisticated and powerful microscopes. HPV and HSV are examples of viruses that can exist on several surfaces and can be spread through indirect and direct contact. So we need to make sure that we are careful with these viruses in this industry. Okay, we have blood-borne pathogens that are disease-causing microorganisms that are carried by the blood or body fluids. These include hepatitis and HIV. Fungi are single-celled organisms that grow in irregular masses that include molds, mildews, and yeasts. Mildew is another fungus that affects plants or grows on inanimate objects, but does not cause human infections in the salon, spa, or barber shop. Most frequently encountered fungal infections are tinea barbae, also known as barber's itch. A person with tinea barbae may have deep, inflamed, or non-inflamed patches of skin on the face and nape of neck. It's similar to tinea capitis. It's a fungal infection of the scalp characterized by red papules or spots at the opening of the hair follicles. And ringworm is a fungal infection that appears in circular lesions. Head lice, or Pediculosis capitis, is a type of a parasite that is responsible for contagious diseases and condition. One condition caused by an infestation of head lice is called Pediculosis capitis. Scabies are a contagious skin disease caused by an itch mite that burrows under the skin. All right, so proper infection control requires 2 steps, cleaning and disinfecting. An alternate is sterilization if you have access to an autoclave. Okay, the cleaning is really important. If I see you guys at the end of the day not using ShipShape to clean before you disinfect, we're going to have write-ups. Okay. Step 1 is cleaning. Ways to clean. So use soap, warm water, and a nail brush, ultrasonic unit, or a chemical cleaner. Chemical cleaner is the ShipShape. So we all are really familiar with the different procedures that are going to be listed in the next couple of slides. So the first one is hand washing. Make sure we do this every day before we start the day. Step 2 is disinfecting. We're going to choose a disinfectant. We have Barbicide or Marvicide. There are mixing ratios, contact time, and all of that are going to be listed on the bottle. You're going to clean and rinse first with the ShipShape. You're going to complete the immersion, which is 10 minutes. And then you're going to rinse. Okay, the different types of disinfectants are for non-porous and porous surfaces. The quaternary ammonium compounds are disinfectants that are very effective when used properly on non-porous surfaces. The tuberculocidal disinfectants are proven to kill the bacteria that causes tuberculosis, in addition to other pathogens destroyed through the use of hospital disinfectants. Okay, so bleach is also known as sodium hypochlorite. It's really corrosive, but it does work really well to kill different things and to clean salons, spas, and barbershops. Chlorine bleach is the only bleach that disinfects, so make sure you have chlorine bleach. All right, some disinfectant and safety tips. Always keep on hand the SDS sheets. Wear gloves and glasses. Avoid skin and eye contact. Pour disinfectant into water. Use tongs, gloves, or a draining basket. Keep disinfectants out of reach of children. Follow instructions. Always disinfect only clean, hard, non-porous surfaces. Contact time default is 10 minutes. Completely immerse. Large surfaces remain moist for 10 minutes. Replace disinfectant daily. Never contact disinfectant immediately, wash if so. Never place disinfectant in unmarked container, and never mix chemicals unless specified. Disinfecting containers. In the past, jars or containers used to disinfect implements were often incorrectly called wet sanitizers. Disinfectant containers contain disinfectant for disinfecting purposes, not cleaning. The container you choose must be large enough to contain all items to be disinfected and covered, but not airtight. Remember to clean the container every day and wear gloves. Salons, spas, and barbershops should always follow manufacturers' recommended schedules for cleaning. And we also have equipment logs for the cleaning and disinfecting. All right, you're going to follow all standard precautions to protect yourself and your clients. Gloves. We have nitrile gloves, not latex, or petroleum gloves. This helps prevent allergic reactions as well as any other kind of interactions with color or chemical surfaces. All right, demonstrate safe work practices and safety precaution. Water with tools and appliances. All right, this is all going to be found in your book. Water, you're going to wipe up any water spills or leaks immediately. With your tools and appliances, always have smaller tools placed on countertop receptacles designed for that purpose. Larger equipment may be mounted under the cabinet, attached to the wall, or set on a shelf. If a tool or implement is dropped on the floor during a service, it must be replaced with a disinfected tool, or you must stop the service and properly disinfect the tool. High-risk clients that you need to practice extra safe work practices and safety precautions are patients with diabetes, to patients who've had a lumpectomy or a mastectomy, immunosuppressors like a client who is undergoing cancer treatment, and a client who is pregnant. Never take shortcuts. Follow state and federal laws. Keep your license current and check for any change to the rules and regulations. Be aware of your environment. Be prepared for emergencies. Always maintain emergency phone number checklist. Keep utility and landlord information updated. Being a professional is something that you can take pride in. So summary review. Federal and state regulations apply to infection control and safe work practices. Bacteria, viruses, fungi, and pathogens are responsible for beauty industry infections. Infections can be controlled through cleaning and disinfecting. Proper hand washing procedures are key. Safe work practices can minimize the occurrence of accidents. Beauty professionals should take their responsibility to protect clients' health and safety seriously. So these next slides are going to be your review questions. They're called check-in questions. What is the difference between cleaning, disinfecting, and sterilizing? What are standard precautions? Why is it the utmost importance to practice strict infection control protocols with every client? List the 5 types of organisms that are important to a beauty professional.